actually think about. All right, so welcome back to part 2 of Real Talk, Mind, Body, and Love. That's what it's called, right?
We're going
Nailed
with
it.
it.
I think so. I'm Dr. Kelly Frank.
Dr. Leslie Worth, and we're continuing about pelvic health and
Sexuality
and what's normal.
and what's common. Yeah.
Yeah.
So
So I know we started touching on like of expectations and from pornography or just from social media and how that can influence, we all have that skewed perspective of what we're supposed to be striving for, and a lot of it's misinformation.
yeah.
And then they come to our offices, and I feel like, at least with me, it's a lot of it like, now we have to deprogram and deconstruct like everything you were taught because it's not true.
Mm-mm.
And it's not sustainable,
Yeah.
We were just joking of like, my older men in their 50s or 60s or even 40s, coming and thinking they have erectile issues because it's not as prominent as it was when they were 20. And I'm like, our bodies change.
Yeah.
And this is based on blood flow. So like there's a lot going into that. Or for women of, if they're going through menopause or anything like that, of like, vaginal atrophy.
Yeah, or just
and
even like
changes.
Yeah, I mean, the differences between, obviously, like we go through puberty, maybe we get pregnant, so then there's like the postpartum. They actually just kind of coined the couple phrases of like the genitourinary syndrome of lactation. So when you are
That's a
postpartum,
mouthful.
yeah, which like is like almost like equates to the genitourinary syndrome of menopause, because you're kind of seeing these like massive decreases in estrogen. So we're going to kind of have very similar things that are going to happen in menopause, which again could be like plus minus 10 years around 47 or 49. But if we're seeing these patients now like have a baby closer to 40,
Sure.
and then we're kind of finishing up with that, and then we're probably like right immediately into perimenopause, and we don't really know the language of it. Like, are we postpartum? Yes, kind of technically always, but then are we also perimenopause? Probably.
Right.
Are we going into menopause? And then like how the labia, like, how that changes, the blood flow of that, the hormones of that, the lubrication of that, and then again, like meeting that with the expectation from ourselves, the expectation of just dealing with more of life on top of us, in addition to like an intimacy role, and then like however your partner, handles that.
Right. And I think with perimenopause, at least in my listening of what's going on, of like, we're really starting to understand like how long of that can be, right?
Yeah.
It's like, it's not just like
Like a day,
right? It's not like perimenopause and the menopause, but it's like it can last, and it can be this long change that we're not really recognizing of what can be going on during that time. And that battles like the Cosmo Girl magazine that I'm seeing at the Publix checkout of do these 6 things to have mind-blowing sex. And it's like, not saying those tips are all bad, but I think it just simplifies it when it's a very complex system. So when someone comes in and says, am I normal? I'm like,
yeah. I don't know what's going on.
I don't know what's going on. We have to look at the whole view of everything that's going on. And also going back to of like, what sex do you want to have?
Sure.
Because you may not want to have the sex that Cosmo Girl is telling you need to have.
Yeah.
Right? So it's also that of like, what's your own value with it, and coming to terms of like, I'm okay if it looks this way, even if it's different than mainstream media is telling me that it should be.
Yeah. Yeah. I think a lot of people kind of wrestle with that. And I think also, like, as we go through these different changes, like, life doesn't always just stop around it either, and, like, lets us accommodate to these things. You mentioned, like, just, like, the blood flow issues. Like, we could also have other kind of disease processes going on. We could be having new cancer diagnoses. We could be having new heart diagnoses. We could be having other physiological problems in addition to environmental stressors, work stressors, family stressors. We might become like a caretaker for a parent or a child, or there's just so much more, I think, that plays into that.
And I think we still try to see our sex life as in a vacuum. So I'll get some pushback from clients sometimes if they're just like, well, why are you asking me about that? I'm like, because it's all interconnected, right? So like, I need to know, like, especially for men, I'm like, do you have hypertension? Like, are there certain medications? Like, we love our SSRIs to help with anxiety and depression. They have a well-known side effect when it comes to libido and other sexual performance stuff. So I remember I had one client, she was disappointed with how much her SSRI was changing her libido, but she also said, like, well, if I'm depressed, it would change my libido. I'm like, yes. So, like, we have to outweigh the options. And also going back to, like, a frequency is not an expectation. You know, like, I have couples out there who are having sex once a month, over the moon. I have couples out there having sex 5 times a week, horrible relationship. Yeah. Right? So it's like, I feel like I'm always battling, like, what's out there of, like, you need to do it this many times, or you need to do it this way, and to get to the best sex life. And
is that like an American thing? Like, we're just comparing and we're just like wanting to, like, just, you know, what value we are or what number we, like, where we kind of, like,
it's always a competition, right?
It's competition.
Like, we have to be number one. Like, I mean, sexuality in general, just how it's talked about, like, in Europe versus here is just very very different. You know, over there it's very much like the topless beaches is not a big deal. Like, it's just like, it's a thing, you know. Teenage pregnancy rate over in Europe, I think at least in France particularly, is lower because they have adequate sex education. For sure. They have access to condoms and birth control, and they're actually having sex later in life than compared to American teenagers. So it is an American culture. But I think it's with social media, it's always been there. It's been in magazines, it's always been on TV. But I feel like with the increase of social media and how quick things are, it's always around us. So I feel like it's so loud that a lot of times I ask clients, like, what do you actually believe? And I think they have a hard time answering that question because, like, have they ever had the quiet time to really think of, like, what's important to me and my relationship versus what I've been bombarded with for years. Yeah.
No, for sure.
And then also that really comes to play when there are, like, cancers or accidents or disabilities, right? Like, no one wants to talk about disabled people having sex. They do, right? Because that doesn't fit the box. Narrative, right? Yeah. So it's people have a lot of shame or beat themselves up of, like, how their body has betrayed them or changed, and it's sad of, like, we rigidly think of sexuality as this one thing, and if we can widen it, it's like we can still have intimacy. It just may not look like how it's been dictated,
like, in the magazines.
Magazines, or
I see that a lot with
movies.
Like our, you know, like with breast cancer patients, prostate cancer patients. I mean, radiation just, it does not do happy things to healthy tissue. And big side effects are kind of like this idea of, like, that fibrosis, which we mentioned, like the vaginismus, but it's similar in nature. But now this is, like, not a muscle spasm. This is just tissue growth and hardening. And so that's going to kind of change either erectile tissue or the vaginal tissue or the anal tissue. You know, it can also just affect the different organs, again, that kind of, like, are at play in this area. And so, if you have, like, a really painful bladder, or you have even, like, IBS or some problem with, like, your rectum or your bowels, like, sex is probably going to hurt and feel different than if you didn't have that kind of disease process.
Right. Right. And how do we widen the definition so you can still have pleasurable sex and not just feel like you're wedged between these certain type of sex acts to I don't know, be sexual. You know, it's just like it's way more than just certain positions or acts that we're doing when it comes to intimacy. Yeah. In that way, you know, I love when I blow people's minds of, like, you can have satisfying sex and never have an orgasm.
It's just being intimate. Yeah.
Just being intimate.
Being intimate, having a connection with either yourself or someone. Yeah. I think it's kind of
that's where I go back to, of, like, what is the purpose for this person or for this couple or for this polycule or whatever, whoever's involved? Like, why are we engaging in this way? What are we trying to get out of it? What's the value of it? And we want to go back to that versus the noise of that it has to look a certain way, you know, you know, women have to wear lingerie and men have to last hours. And I mean, all these things are just like, I mean, you can wear lingerie.
Sure. If it makes you happy.
If it makes you happy. If you want to try to maintain your erections longer, go for it. But it's going back to, like, that doesn't define
that moment or, like, that intimacy or that setting. Yeah, absolutely.
And I see a lot of even older men, like, they'll go to extremes to make sure they boil themselves down to their erections. And it's like, the Cialis or some really extreme thing, the penile implants. I'm like, if that's what you want to do, that's fine. It's great.
Yeah.
But I never want someone to feel like they're pressured they have to do that because they feel less of a man if their penis doesn't get hard.
I think it's become maybe a little bit less stigmatized because you'll see the rise of, penis pills kind of thing more recreationally. You see that, the popular podcasts that have a large male demographic, they have a discount code for their users to BlueChew or whatever it is .com, kind of thing. So do you think that's helped? Interesting question here. Do you think that's helped out with people feeling more comfortable, or do you think that now they're just like, hey, I might get lucky tonight, let me pop something? Because overtaking pills too, can I imagine, lead to other complications?
Well, because going back to of an erection is blood flow, right? So if we're taking medicine, like, it has to be doing something on the cardiovascular system.
Yeah.
I'm not a cardio doctor, but that just makes sense.
Vasodilation makes the blood flow
right.
more.
Yeah. So on one hand, like, do I think it's good that we're just talking about it more openly? Sure. But I think it also can set false expectations too of like, do I have to have this so I can last for this long because that's the expectation of what this encounter is? Or a lot of times with erectile dysfunction, it's gone down and then they freak out and it goes away, because if we look at a lifeline of erection, it gets hard and then it goes down and goes, it does up and down.
We go through stuff.
Well, because it's blood flow. So it's like, if you're focusing your attention on something else, like, it may get a little flaccid, but it doesn't mean it can't get back again. So, like, a lot of times with guys, it's the anxiety of, like, they get hyper aware of, like, oh, I'm losing it and I won't be able to get it back. And it's like, that thought process is what is the killer, versus just recognizing of, like, it's going to wane and wax and go up and down. And if you're having real issues, that's when you want to look at other physiological concerns, right? Like, if you're having difficulty maintaining erection, like, maybe not just pop a pill, but maybe we need to look at
like
cardiovascular
well, I mean,
stuff.
Things like, too much caffeine consumption, right? That restricts the blood vessels.
Well, just your diet, your stress, again,
so
your
environment.
Alcohol, I'm sure we've all heard of, like,
alcohol,
whiskey dick.
Whiskey wang.
All that stuff.
So it's, this is where we go back to, of like, we've been fed, at least in my opinion, we've been fed this, like, it should be this easy, and if you do these things, this is where you get to your results. And the more and more I learn about it, it's like, it's so much more complex than that. And if we don't feel comfortable just talking with our partner in the moment, or if we feel like we're going to be judged or shamed if we don't perform a certain way, that's a problem. Like, we need to be able to communicate of what's going on.
And I think too, it's like, we kind of just talked about, like, all, like, the male-centered things, but then also, like, we're treating this, like, male, a penis for, like, an erection problem, but, like, have we even talked about, like, the tissue that it may or may not be penetrating?
Right.
Like, maybe we should also, like, have a conversation with, like, wow, at the same time that, like, men may or may not be having this problem, like, we're going through perimenopause or menopause. Our tissues are physiologically changing, like that. Those hormones are leaving, like, there is going to be less blood flow. Things will get, like, a little more atrophied or uncomfortable. And so kind of, like, back to one of our initial points too, of just, like, the act of whatever that sexual encounter is or intimacy, it has to change.
Right.
Your body does change over time.
Yes. Or even if it's not menopause, of just, like, with lubrication, some women struggle just with that, and we can tie it to, of like, well, then I'm not really attracted to the person, and I'm like, that has nothing to do with it.
It's how your tissues are.
It's biological, and also just, like, if you're so stressed out about it, like, just how a guy can't get an erection, like, you may not be able to provide the lubrication that's needed. So I feel like I'm always just on repeat. I'm like, always circles back to, of like, knowledge and communication, and just being self-aware of, like, how my body operates, not how media tells me it should operate, and working with a provider of really understanding the inner workings of everything and how it's all connected.
Yeah, just getting, like, the correct education, hopefully from the get-go, or if you don't have it and now you're an adult, like, finding those correct providers, having honest conversations with whatever medical doctor, therapist, whoever it might be. And then you can kind of, like, take it to those next steps.
Right. Perfect.
Yeah. I think that's awesome.
And I think in a future episode, we're going back to what you're saying of just, like, with is the tissue on the receiving end ready? We need to talk about, like, desire and arousal and pleasure, and going through that of just like debunking those myths too of even how to get into
debunking.
That's our job, to get into that setting before sex can even happen. Like, how do we even get there?
Oh, I'm excited for that episode.
And doctors, would you feel comfortable if we offered this? Maybe people that are listening or watching to this in the comments, if they have questions that pertains to any of this, fire away.
Yes.
Right? Total safe space. And but now you may have heard my voice. I ask some dumb questions sometimes, right? Where but these two doctors are phenomenal at making me feel comfortable to where I can ask it and have a fantastic answer. So please feel free to ask questions in the comment section.
Yeah.
Absolutely.
You don't know what you don't know.
You don't know, you don't know. And there's no such thing as a dumb question. No.
I appreciate that.
Yes.
But of course, if you think it's too weird, slip into the DMs, right? Be polite, be kind of polite, but you can ask it there too for some privacy.
Right.
Yeah.
Yes. Yes. And we will link our websites to everything, so you can send us an email if that feels more comfortable or anything like that.
A little safer. Yeah.
We're here to educate, and we're giving you information based on what we think is helpful, but it's always great to hear what you think would be helpful, and what questions you have.
I love it.
All right. Until next time.